You would like to know how to keep your heart healthy and happy for the rest of your life and or reduce or completely eradicate any issues you're already having with your heart. You clicked on the right video. Hi, I'm Dr. Cori Stern, and welcome to my channel, Take Control of Your Health. If you have not yet had a chance to subscribe, I would appreciate it if you would hit the subscribe button right now, because that is my reward for putting out this information for you. So today's subject is really important because there are so many people that I'm seeing with heart issues, and everybody knows that heart is a vital organ. You can't really stay alive without it, and you can't live a normal functional life if it's not working properly. One of the things that I run into all the time is talking to people about what causes heart disease. What is the number one cause of heart disease? And when you ask people that question, usually the answer they will give you is high cholesterol. And that's what the majority of people think. That's what medical doctors tell you. If you go to get blood work done and your cholesterol is high, you'll be told that you're at risk for heart disease and that you need to go on a pharmaceutical to lower your cholesterol. I had a patient once tell me that a medical doctor told her that if she did not go on a pharmaceutical to lower her cholesterol, she would be dead within 5 years. Okay, so high cholesterol is not the primary cause of heart disease. It's not. I have two very detailed videos on cholesterol on this channel. I will put a link to those videos in the description of this one, so I can you can hear me elaborate on cholesterol. Cholesterol is actually an essential nutrient. It's an essential component of your body. Your brain cannot function without cholesterol. Your hormones are made out of cholesterol. So the quantity of cholesterol that you have is not the issue. Quality of cholesterol is the issue. I go into detail about that in those other videos. That's not what I want to talk about right now. What I want to talk about is diet, the connection between what you eat and your heart health. And I've been seeing articles coming out, conventional news media articles, conventional medical articles coming out about the connection between sugar consumption or refined carbohydrate consumption. Refined carbohydrates turn into sugar in your body, and heart disease. It's just something that us alternative doctors have always known. We've always talked about this. But the conventional world has always focused on things like high fat diet, a high cholesterol diet being the cause of heart disease. And then it switched to not necessarily high fat, but what kind of fat? Saturated fat, animal fat causes heart disease. No, that is incorrect. Animal fat is not bad for you if it comes from a healthy animal, right? And that's the key, is what you're eating, good quality. And I want to focus on sugar a little bit because sugar is the underlying cause of damage to the heart in most cases. Of course, there are other factors like smoking cigarettes, drinking too much alcohol, not being active enough, stress, all of those things can contribute. But sugar, a high sugar or high refined carbohydrate diet will set the stage for damage. Now, how does that happen? Sugar is inflammatory. It damages things in your body. Our bodies weren't designed, from a biologic viewpoint, our bodies are not designed for eating a lot of sugar. In nature, sugar is not that easy to access. You have to fight bees to get honey. You have to get into the bark of a tree to get maple syrup. You have to, without technology, get into a sugar cane to get sugar out of it. So nature designed things in a way that make us not be able to access concentrated high quantities of sugar that easily. Now, of course, with technology, the modern diet, all of that, it's readily available. It's in all processed foods. Most people are eating too much of it. How much is too much? That's a question I often get asked. So it really depends on you as an individual. If you have cancer, no sugar. You cannot eat any sugar. If you have infections, you cannot eat sugar. Sugar feeds cancer, sugar feeds pathogens. If you have autoimmune disease, which is inflammation, you shouldn't eat sugar. Sugar increases your inflammation. If you have diabetes, you should not eat sugar at all. So it'll just make it worse, right? If you're a very, very healthy person, you may be able to tolerate some good quality, unrefined, unprocessed things like honey or maple syrup, um, that kind of thing, fruits. So why is sugar so bad for you? Number one, sugar causes inflammation, which damages the lining of your arteries. So your arteries, the lining of your arteries are like, think of it like a smooth road. If they're in good health and in good shape, they're like a smooth road where stuff travels through them, your blood, your cholesterol, your fat, all your stuff travels through your arteries and gets to where it needs to go, gets delivered to where it needs to go. But if there's inflammation in your arteries, it causes that smooth road to become damaged. Now it has potholes in it. Now it has pieces sticking up that don't allow smooth passage. And then stuff gets stuck in there. For example, sticky stuff like cholesterol is sticky like fat. And then it builds up and then it can harden. That's what's called hardening of the arteries or atherosclerosis, where you get plaquing inside the arteries, which stops blood flow. Okay. So the key is making sure that you're not inflamed. High sugars, refined carbs, refined food, processed food, bad food, and also seed oils are all very inflammatory. I have a lot of videos about the difference between good and bad fat, right? So refined, man-made, commercial cooking oil, bad, especially if it's seed oil derived from seeds, sunflower, safflower, canola. I have a video called, well, I don't remember what my videos are called, but something about what kind of cooking oil should you use or something like that. I can put a link to that in the description of this video as well. So the take-home message here is that the key to having a healthy heart, not creating damage in your arteries, is to not eat inflammatory foods, other things that cause inflammation that I mentioned earlier, like alcohol and smoking cigarettes and stress and not exercising and not getting enough sleep and all of those things. So all of them contribute to a healthy heart or an unhealthy heart, but it all has to start with clean, nutrient-dense diet. Now, you may have heard me talk about on other videos where I get most of my food from. So there's an organization called Farm Match that will match you with, if you're in the US, with a farm that grows clean, nutrient-dense food, small-scale family farm, where you can actually know the farmer. My farmer writes a little note that he puts in with my eggs every time I order them, where he tells me what's going on in the farm and what's happening with his family. I absolutely love reading that. So if you're anywhere in the US, you can go on farmmatch.com/Dr. Cori, DRCORI, and put in your zip code and get matched with one of these farms where you can get food that will be good for your heart and help it stay healthy. If you're not in the US, I have another link that you could take a look at, which will be in the description of this video. Right now, I'd like to share with you a couple of my favorite supplements for reducing inflammation and feeding your heart so that it stays strong and healthy and happy. So the first one is not this. I'm not good at screen sharing. Okay, try again. The first one is this, turmeric. Most people know about turmeric. Most people are familiar that turmeric is anti-inflammatory. So this is a great supplement to help prevent inflammation or get rid of inflammation that you might already have. This particular turmeric is special because, first of all, it has the right amount of active ingredient in it. The active constituent in turmeric is called curcumin. So it is fully tested. We know that it has active curcumin in it, so it's very effective. And it also has fenugreek. And fenugreek actually helps turmeric to work better. Fenugreek has some of its own health benefits as well. It's good for diabetes. It's good for congestion. It thins mucus. It's good for promoting breast milk for breastfeeding moms. So fenugreek has so many other health benefits as well. The next supplement I'd like to talk about is another herb called hawthorn. Hawthorn has been used for, the beginning of time, has been used since the beginning of time for heart health. It helps the heart muscle to become stronger. So it actually strengthens your heart function. And also helps to stabilize blood pressure. So if you're having an issue with blood pressure, this is a great supplement to choose. The next one I want to talk about is a weird name. It's called Cataplex ACP. Cataplex means vitamin. And ACP is vitamin A, vitamin C, and P is what we call rutins or bioflavonoids. They help to strengthen blood vessels. So this is, by the way, the heart needs vitamin C also to function properly. Vitamin C is needed by your heart, by your adrenal glands, by your immune system, by your blood vessels, by your skin, helps produce collagen. And vitamin A also it's a vitamin that doesn't get talked about very much. I should do a whole video just on vitamin A. But the combination of that's in here helps to strengthen your blood vessels. It also happens to strengthen your gums. So it's really good for your gums. It helps your mucous membranes, your sinuses, your lungs. So it's also really good for your immune system. So it's a great, like kind of multi approach to many different organs in your body. And the next one I want to talk about is this source of minerals called Organically Bound Minerals. The minerals in here help with your heart rhythm. So it helps to maintain the neurological part of the heart function. The minerals in here are also really good for supporting your thyroid. There's some iodine in it. It really helps your entire body. They're just really good minerals. They help with cellular energy. supporting your muscles, your scalp, your bones, and your metabolism. And then the last thing I want to talk about is fish oil. So this is one of my favorite fish oils because fish oil is critically important to heart health. So it's the heart needs fish oil, your eyes need fish oil, your brain needs fish oil. This particular one is higher in the component of omega-3 fatty acids called DHA. So omega-3 fatty acids have DHA and EPA as their main components. This one is a little higher in DHA, which is really important for brain function. It's also important for kids, for developing fetuses and for children, for brain development. It's really important for your skin, for your eyes, and then it's really good for people who have anxiety or who are type A personalities like me, who are always productive, getting things done, always on the move. It helps your nervous system stay a little more stable. So I do take that supplement as well. So that's my presentation. I hope this was helpful. Please let me know if you have any questions. If you have not checked out my website, drcori.com, a link to it will be in the description of this video. I have a whole online store where I have these products, plus more, many, many more, more products for your heart and every other system in your body. And if you need specific help with your heart or with anything else related to your health, do not hesitate to reach out to me. You can fill out a form on my website, or you can email me at questions@drcori.com. That email will be in the description of this video. I have health improvement programs. Some of them are, very comprehensive, and some of them are just one-shot deals, totally affordable for most people. So I hope that I will hear from you. Please don't hesitate to write comments on this video. If you liked it, please hit the like button because it helps other people find it. And last and most importantly, please share this with anyone you know that you think would benefit from the information. I hope to see you again very soon with another video. And until then, please stay healthy.